Over 75? If you feel dizzy after standing, do this first. It usually lasts only a few seconds. You open your eyes, you shift in bed, you swing your legs over the side, you stand, and suddenly the room feels slightly darker. Your vision narrows, your balance wavers. Maybe you grab the nightstand, maybe you pause and wait for it to pass, then within 3 to 5 seconds it fades, and you tell yourself it is just age, but here is what most people over 75 are never told. Anna, that brief wave of dizziness is not random. It is not weakness. It is not simply getting older. It is a transition failure inside your circulatory and nervous system. And when that transition fails repeatedly, the risk is not the dizziness itself. The risk is what your body does during those unstable seconds. Let me explain clearly and calmly what is happening. When you lie down overnight, gravity is no longer pulling blood toward your feet. Your body is horizontal. Blood distributes more evenly. Your heart does not have to pump upward against gravity to supply your brain. Your vessels relax slightly. Your lower leg muscles are quiet. Your calf muscles, which normally act as a secondary pump for your circulation, are inactive. Now imagine what happens the moment you stand. Gravity returns instantly. Blood begins to shift downward into your legs. Your cardiovascular system must respond quickly. Your blood vessels must constrict. Your heart rate must adjust. Your nervous system must signal the muscles in your legs and hips to stabilize you. All of this must happen within seconds. If the response is slightly delayed, even by a fraction, your blood pressure drops briefly. When blood pressure drops, less oxygen-rich blood reaches your brain. When the brain senses reduced oxygen, it creates that familiar sensation, lightheadedness, dim vision, unsteadiness. This is called an orthostatic blood pressure response. The word sounds complicated. The mechanism is not. It simply describes how your body adjusts when you change position. In younger adults, this adjustment is almost instant. In adults over 75, the response is often slower. Not because you are fragile, but because certain systems naturally become less responsive with age. Your blood vessels may not constrict as quickly. Your nervous system signaling may be slightly delayed. Your calf muscles may not activate immediately. Your hips and core may not engage fast enough to stabilize your center of gravity. Each of these changes is subtle. Individually, they may not seem important. Together, they create instability in the first few seconds after standing. And those seconds matter more than most people realize. Here is something that is rarely explained clearly. The danger is not the dizziness. The danger is the reflex movement that follows it. When you feel lightheaded, your body reacts automatically. You may tense your shoulders. You may lean forward, you may take a short, hurried step, you may shift your weight unevenly. This micro-reaction is what increases fall risk. Your balance system depends on coordination between 3 things: vision, inner ear feedback, and muscle activation. When vision dims for even 2 seconds, one of those systems is compromised. If muscle activation is also delayed, you now have 2 unstable systems at once. That is when a small misstep becomes significant. Now let us talk about why this response becomes more common after 75. First, vascular elasticity changes with age. Your blood vessels may become less flexible. Flexible vessels constrict quickly. Less flexible vessels respond more slowly. Second, muscle mass naturally declines over time. Even active seniors experience gradual muscle loss. The muscles in your calves and hips play a major role in pushing blood upward when you stand. If those muscles are weaker or slower to activate, blood pools longer in your lower body. Third, hydration levels matter more than most people think. As we age, thirst sensation can decrease. Mild dehydration reduces blood volume. Lower blood volume increases the likelihood of a temporary pressure drop when standing. Fourth, certain medications can influence blood pressure regulation. This does not mean medications are wrong. It means your body's transition response may require more preparation. But here is the key point. This is not an unavoidable decline. It is a system that needs preparation. And most seniors are never taught to prepare before standing. They are taught to move carefully. They are told to use support, but they are not shown how to stabilize their internal pressure response before putting weight on their feet. Think about the sequence most people follow. Alarm rings, eyes open. Legs swing, stand up immediately. The body is given no time to adjust, no time to activate circulation, no time to signal stabilizing muscles. It is like starting a car in winter and driving instantly at high speed. The engine needs a few moments to warm and stabilize. Your cardiovascular system is no different. Let me describe what happens during those first unstable seconds. When blood shifts downward, your brain detects a slight drop in pressure. Special sensors in your arteries send signals to the brainstem. So the brainstem sends signals back to your heart and blood vessels. Increase heart rate slightly, constrict vessels slightly, stabilize flow. This reflex is called the baroreceptor response. It is automatic, but it can be trained and supported. If you rush the transition, the reflex is forced to work harder and faster. If you prepare the system first, the reflex becomes smoother and more efficient. Here is another important factor. So the first step you take after standing often determines your stability. If your hip muscles are not engaged, your pelvis may tilt slightly forward. If your core is not active, your spine may round. If your calves are not primed, your ankle response may be delayed. These small mechanical changes shift your center of gravity. When your center of gravity shifts forward unexpectedly, your body must correct quickly. Quick corrections require strength and coordination. Without preparation, that correction can feel unstable. So many seniors describe the feeling as, "I just didn't feel steady." That description is accurate. It is not dramatic weakness. It is delayed coordination during a pressure transition. Let me ask you something. Does the dizziness happen more in the morning than later in the day? For many people, it does. Why? Because overnight immobility increases pooling in the lower body, and morning blood pressure tends to fluctuate more due to hormonal cycles. Now, your body is transitioning from a resting state to an upright state. That transition is the vulnerable window. Now, here is the encouraging truth. The orthostatic response can improve with consistent preparation. Your nervous system remains adaptable. Even after 75, muscle activation patterns can be strengthened. Even after 80, circulation efficiency can improve. Even after years of lightheaded mornings. But it requires understanding the sequence, and it requires slowing down the first 30 seconds of your day. So the mistake many people make is trying to solve dizziness by moving less. They hold on to furniture longer. They reduce walking. They become cautious. Caution is understandable. But preparation is more powerful than caution. Preparation strengthens the system. Caution simply avoids testing it. Let me clarify something important. If dizziness is severe, if it lasts longer than a few seconds, if it is accompanied by chest pain, fainting, or confusion, medical evaluation is necessary. What we are discussing here is brief, position-related lightheadedness, the common type many seniors experience when rising too quickly. That type often responds to preparation. In this video, we will not focus on stretching. Stretching lengthens tissue. It does not regulate pressure transitions. We will focus on circulation priming, muscle activation, and controlled position changes. Because when you understand the sequence, you remove the surprise. And when you remove the surprise, you remove much of the instability. The most dangerous moment of the day for many adults over 75 is not walking outside. It is not climbing stairs. It is not exercising. It is those first 3 seconds after standing from bed. And the reason is simple. Your body has not yet fully transitioned from horizontal to vertical. If you prepare the transition, the dizziness often becomes less intense, less frequent, or disappears entirely over time. But that preparation must happen before your feet bear weight. In the next part, I will show you a simple 3-step morning reset sequence. It takes less than 5 minutes, it requires no equipment, and it is designed specifically to stabilize blood pressure response before you stand. Because the pause before you rise may be the most protective moment of your entire day. If you have ever felt that brief wave of lightheadedness, if you have ever grabbed the wall for stability, if you have ever hesitated before taking your first step, stay with me. The solution is not dramatic, it is deliberate, and it begins before your feet touch the floor. Over 75, if you feel dizzy after standing, do this first. In part 1, we talked about what causes that brief wave of lightheadedness. Now let me show you how to stabilize your body before you ever stand. This is not a workout, it is not stretching, it is not about pushing through discomfort, it is a 3-step reset sequence. Preparation, activation, controlled rise, the entire process takes less than 5 minutes, and the order matters. Let us begin with step 1. Circulation priming. When you wake up, do not sit up immediately. Stay lying on your back. Take 1 slow breath in through your nose. Exhale slowly through your mouth. Now bring your attention to your lower legs. Your calf muscles are often called your second heart. That is not dramatic language, it is descriptive. Each time your calves contract, they help push blood upward toward your heart. When you have been lying still overnight, those muscles have been inactive for hours. Blood settles more in the lower body. Before you stand, you want to wake those muscles gently. Start with ankle pumps. Point your toes away from you slowly, then pull them back toward your shins. Move deliberately, not quickly. Hold each position for 2 seconds. Feel the muscles in your calves tighten. Feel them release. Do 10 slow repetitions. Then pause for a moment. Next, add ankle circles. Slowly rotate your right ankle clockwise 10 times, then counterclockwise 10 times. Switch to the left ankle, again slow and controlled. This is not about speed, it is about full range movement. As you do this, something important is happening. Each contraction of your calf muscles squeezes the veins. That squeeze encourages blood to move upward, it reduces pooling, it gives your cardiovascular system a head start. Now add gentle foot presses. Keep your heels resting on the mattress. Press your toes downward slightly as if pressing a soft pedal. Hold for 3 seconds, release, repeat 5 times. These small movements may feel simple, but they prime the system. They give your blood vessels time to adjust. They begin activating the pressure reflex before gravity fully shifts. Take another slow breath. Notice how your lower legs feel warmer, slightly more awake. That is step 1. Now move to step 2, core and hip activation. This step is critical. Many people focus only on circulation. But stability requires muscle coordination. When you stand, your hips and core must engage quickly. If they activate slowly, your posture shifts forward. Forward shift increases instability. So before sitting up, wake those muscles. Bend your knees so your feet are flat on the bed. Keep your back resting comfortably. Place one hand on your lower abdomen. Gently tighten your abdominal muscles, not forcefully, just enough to feel engagement under your hand. Now lift your right foot a few inches off the mattress, slowly. Controlled, keep your lower back gently pressed into the bed. Hold for 2 seconds. Lower slowly, switch sides, lift the left foot, hold, lower. This is a modified supine march. It activates hip flexors, it activates deep core stabilizers. It tells your nervous system that your legs are about to bear weight. Perform 10 repetitions on each side. Move steadily, not rushed. Now add a small bridge. Keep your knees bent, feet flat. Gently squeeze your glutes. And then lift your hips slightly. Not high, just enough to feel the back of your hips engage. Hold for 3 seconds, lower slowly. Repeat 8 to 10 times. This movement activates the posterior chain, the glutes, the hamstrings, the lower back stabilizers. These muscles support your pelvis when you stand. If they are inactive, your body may sway. If they are awake, your center of gravity remains more stable. Notice something important. We are not exhausting the muscles. We are activating them. There is a difference. Activation prepares the nervous system. It improves recruitment timing. It strengthens the connection between brain and muscle. Now pause for a moment. Take one more slow breath. You have primed circulation. You have activated stabilizers. Now we move to the most important step. Step 3, the controlled rise sequence. This is where most falls begin, not because standing is dangerous, but because standing too quickly forces the system to react instead of prepare. First, roll gently onto your side. Use your arms to assist. Pause there for 3 seconds. This small pause allows your blood pressure to begin adjusting to partial elevation. Now push yourself up into a seated position. Keep your feet on the bed. Sit upright, but do not stand yet. This is the critical moment. Place both feet flat on the floor. Sit tall, hands resting on your thighs. Now wait. Count slowly to 10. 1, 2, 3. Breathe normally. Do not hold your breath. 4, 5, 6. During this pause, your baroreceptor reflex activates. Your blood vessels constrict. Your heart rate adjusts slightly. Blood flow stabilizes. 7, 8, 9, 10. Now before standing, take one deeper breath. As you exhale, gently engage your core. Lean slightly forward from your hips, not from your neck. Press through your heels. Stand smoothly, not abruptly. Once standing, remain still for 2 seconds. Allow your balance system to recalibrate. Only then take your first step. The sequence may feel slower than your usual habit. That is intentional. The pause is protective. Most dizziness episodes occur because people skip this pause. They swing their legs down and stand immediately. When that happens, gravity shifts faster than the reflex can compensate. By adding this short delay, you give your body time. Time improves stability. Now let us talk about what not to do. Do not swing both legs down and launch upward in one motion. Do not lock your knees when standing. Locked knees reduce circulation return. Do not look down at your feet immediately. Looking down shifts your center of gravity forward. Keep your gaze neutral. Do not rush the first step. Let your system stabilize first. Many seniors feel pressure to move quickly, especially if they need the restroom, but speed increases instability during transition. Preparation reduces urgency. If nighttime urgency is common for you, consider sitting upright for a few seconds before fully standing. Small adjustments make measurable differences. Now you may be wondering, how long before this reset sequence makes a noticeable change? Some people feel improvement within days, others notice changes after several weeks. What improves first is confidence. You begin standing without that sudden wave, then stability improves, then hesitation decreases. Remember, we are not forcing your blood pressure to behave differently. We are training your system to transition more smoothly. Smooth transitions reduce surprise. Reduced surprise reduces reflex instability, and reflex instability is often the true trigger for falls. Consistency is important. Do this sequence every morning, even on days when you feel fine. Prevention works best before instability develops. If you wake during the night, you can use a shortened version. Ankle pumps. Pause seated, controlled rise, and some 3 simple steps. The goal is not perfection, the goal is repetition. Repetition reinforces neural pathways. Reinforced pathways respond faster. Faster response improves balance. This is preparation, not reaction. Many seniors only think about fall prevention after a fall occurs, but prevention begins in the first 30 seconds of the day. Your body is capable of adaptation, even after 75, even after years of lightheaded mornings. The key is respecting the transition, lying to sitting, sitting to standing, standing to walking. Each phase deserves a pause. In part 3, we will talk about what changes long-term when you follow this sequence consistently. We will discuss how small morning adjustments compound into improved independence. Because the first 5 minutes after waking do not just affect how steady you feel, they influence how confidently you move for the rest of the day. Over 75? If you feel dizzy after standing, do this first. In part 1, we explained why that brief wave of lightheadedness happens. In part 2, we built a 3-step reset to stabilize your body before standing. Now let us talk about what happens over time when you practice this consistently, because the true benefit is not just fewer dizzy mornings. It is long-term stability, it is confidence, it is independence. Most people think dizziness is a momentary inconvenience. But repeated instability changes behavior. When you feel unsure standing up, even slightly, that your brain records it. The next morning, you anticipate it. Anticipation creates tension. Tension changes posture. Changed posture shifts your center of gravity forward. Forward posture increases instability. Over weeks and months, this small pattern compounds. You begin moving more cautiously, you reduce speed, you shorten steps, you avoid certain movements. Your activity level drops slightly. That drop may seem small, but reduced movement leads to reduced muscle stimulation. Reduced stimulation leads to slower reflexes. Slower reflexes increase instability. This is how a 3-second sensation can quietly influence years of mobility. Now imagine the opposite pattern. You wake up, you perform circulation priming, you activate your hips and core, you pause before standing, you rise smoothly, you do not feel that wave of instability, your brain registers stability. That stability reduces anticipatory tension. Reduced tension improves posture. Improved posture improves balance mechanics. Better mechanics increase movement confidence. Confidence encourages more activity. More activity maintains muscle responsiveness. The compounding effect works in your favor. This is the independence multiplier effect. Small daily preparation creates measurable long-term stability. Let us talk about what changes physiologically after several weeks. First, vascular responsiveness improves. When you consistently prime circulation before standing, your blood vessels become more efficient at constricting during position changes. The baroreceptor reflex becomes smoother. It does not react in panic mode. It transitions calmly. Second, muscle activation timing improves. When you practice engaging calves, hips, and core before standing, your nervous system learns to recruit them faster. Faster recruitment means better stabilization during sudden shifts. Third, psychological confidence increases. This may sound subtle, but it is powerful. Fear of instability increases fall risk. Calm movement reduces it. When you trust your morning transition, you move with less hesitation. Less hesitation reduces compensatory swaying. Let me clarify something important. This reset sequence does not eliminate all dizziness for everyone. Certain medical conditions require medical evaluation. But for common position-related lightheadedness, preparation often reduces frequency and intensity significantly. Now let us review the full 5-minute blueprint clearly. Step 1. While lying down, begin with ankle pumps. 10 slow repetitions. Then ankle circles, clockwise and counterclockwise. Add gentle foot presses. Total time about 2 minutes. Purpose: stimulate circulation. Wake the calf pump. Reduce blood pooling. Step 2. With knees bent, perform slow supine marches. 10 each side. Add small glute bridges. 8 to 10 repetitions. Purpose: activate hips. Engage core stabilizers. Prepare posture control. Step 3. Roll to your side. Pause. Push to seated position. Feet on floor. Wait 10 seconds. Breathe normally. Stand smoothly. Pause 2 seconds before walking. Purpose: allow blood pressure reflex to adjust. Prevent sudden pressure drop. Reduce reflex instability. The entire sequence takes less time than brushing your teeth, yet it influences how stable you feel for hours. Now let us address a common question. What if you feel fine most mornings? Should you still do it? Yes. Prevention works best before symptoms worsen. The goal is not to react to instability, it is to prevent it. Another question. What if dizziness still occurs occasionally? Then, extend the pause. Sit for 15 seconds instead of 10, add 1 extra set of ankle pumps, increase hydration slightly if medically appropriate. Small adjustments can improve results. Now let us discuss hydration briefly. Mild dehydration reduces blood volume. Reduced blood volume increases the chance of pressure drop when standing. Drinking adequate fluids throughout the day supports stability, but avoid drinking large amounts immediately before bed if nighttime bathroom trips increase fall risk. Balance matters. Let us also discuss posture. When standing, avoid locking your knees. Locked knees reduce blood return. Keep knees softly relaxed, engage hips gently. Look forward, not down. These details matter more than most people realize. Now consider the long-term impact beyond dizziness. When morning stability improves, walking confidence increases. When walking confidence increases, outdoor activity increases. When activity increases, muscle maintenance improves. When muscles remain responsive, balance improves. When balance improves, fall risk decreases. Reduced fall risk protects independence. Independence protects quality of life. Everything connects. The body does not decline randomly, it adapts to patterns. If the pattern is rushed transitions, instability increases. If the pattern is prepared transitions, stability increases. You do not need intense workouts. You need consistency. 5 minutes every morning. The most powerful health habits are often the simplest. This is one of them. Let us also talk about nighttime awakenings. If you wake during the night, use a shortened reset. Ankle pumps, pause, seated. Controlled stand. Even in the dark, preparation reduces risk. Keep a small light nearby. Avoid walking immediately without orientation. Take 2 steady breaths before moving. Many falls occur during nighttime bathroom trips. Preparation applies there too. Now let me address something emotional. Some seniors feel frustrated by needing to move slower. Slower does not mean weaker. Slower means deliberate. Deliberate movement prevents emergency corrections. Emergency corrections are what cause falls. Intentional transitions preserve control. Control preserves dignity. Dignity preserves independence. There is no weakness in preparation. There is strength in foresight. If you have experienced a fall in the past, this reset becomes even more important. Fear after a fall can alter posture unconsciously. Conscious preparation rebuilds trust. If you have never fallen, this reset protects that record. It is easier to prevent instability than to recover from injury. Let us summarize clearly. Dizziness after standing is usually a temporary blood pressure adjustment. After 75, that adjustment may be slower. Rushing magnifies the effect. Preparation reduces it. Activation improves muscle response. Pause improves vascular response. Controlled rise improves balance. 5 minutes can influence 16 waking hours. The first 30 seconds after waking matter more than most people realize. Your body transitions from horizontal to vertical. Respect the transition. Do not fight it. Support it. And over time, that support becomes automatic. One final reminder, if dizziness is severe, if you lose consciousness, if symptoms persist, consult a medical professional. Education supports health, but medical evaluation is important for persistent or worsening symptoms. For common brief lightheadedness related to standing, preparation is powerful. Start tomorrow morning. Do not rush. Prime circulation. Activate stabilizers. Pause before rising. Stand smoothly. Let stability become habit. Because after 75, independence is not preserved by speed, it is preserved by preparation.